अल्लाहुम्मा आसिना आकिबतना फिल उमूरि कुल्लिहा व अजिरना मिन ख़िज़्यि दुनिया व अज़ाबिल आखिरह। इलाहुल आलमीन हमारे कामों में आसानी और कामयाबी के सामा पैदा फरमाइए। या इलाहुल आलमीन आज हम कर रहे हैं तथा इलाहुल आलमीन हमारे इस मुल्क इस खित्ते के लिए इस कैंसर के मेनस को इलाहुल आलमीन उठा लीजिए और या इलाहुल आलमीन हमें शफा अता फरमाइए। सल्लल्लाहु तआला अला खैर खल्क़ि मुहम्मद व आलिहि वसल्लम। अल्लाहुम्मा आसिना आकिबतना
अल्लाहुम्मा सल्लल्लाहु अलैहि वसल्लम तबारक या रब्बल इकराम। रब्बना आतिना फिद दुनिया हसनतन व फिल आखिरति हसनतन व क़िना अज़ाबन नार। अल्लाहुम्मा अहसिन आक़िबतना फिल उमूरि कुल्लिहा व अजिरना मिन ख़िज़्यि दुनिया व अज़ाबिल आखिरह। आमीन सुम्मा आमीन बिरहमतिका या अरहमर राहिमीन।
वेलकम सर। सर आई एम डॉक्टर सदफ़र, कंसल्टेंट रेडियोलॉजिस्ट। सर ये हमारी मैमोग्राफी मशीन है और मैमोग्राफी एक ऐसा टेस्ट है जिससे ब्रेस्ट कैंसर को हम बहुत अर्ली स्टेज पे पिक कर सकते हैं और जितनी अर्ली स्टेज पे पिक करेंगे उतना ही उसका क्योर रेट 100% हो सकता है। तो ये सर मशीन हमारी 3 डायमेंशनल टोमोसिंथेसिस मशीन है और जो इस वक्त अवेलेबल मेजॉरिटी ऑफ दी हॉस्पिटल्स में सिस्टम है वो 2 डायमेंशनल सिस्टम है। और सर ये मशीन जो है ये किसी भी दुनिया के बड़े हॉस्पिटल लीडिंग हॉस्पिटल्स में जो मशीन्स इंस्टॉल्ड हैं उनसे एट पार है। और इस तरह की मशीनें मज़ीद हमने मल्टीपल हमारे PAEC के जो हॉस्पिटल्स हैं उसमें मतलब इंस्टॉल्ड हैं एंड वी आर यूजिंग इट।
वंडरफुल, थैंक यू वेरी मच फॉर
This has been installed.
सर ये हमारा 2022 में शुरू हुआ था और इसकी इंस्टॉलेशन 24 के एंड में हुई है।
Now it's operational.
जी सर, इट इज़ ऑपरेशनल।
The Chief Guest, His Excellency Mia Muhammad Shehbaz Sharif, the Prime Minister of Pakistan. Now we will watch a short documentary about the contribution of Pakistan Atomic Energy Commission in socio-economic betterment of the people of Pakistan.
Pakistan is a nation blessed with timeless beauty, a land where deserts meet seas, where mighty rivers carve valleys, and where mountains touch the sky. But Pakistan is blessed with something far more enduring, the bond of care that ties its people together. Established in 1956, the Pakistan Atomic Energy Commission has dedicated itself to turning the peaceful power of nuclear science into service for the nation. Among all these contributions, none touches human lives more intimately than PAEC's work in health. Today, this nationwide network of 20 hospitals stretches from Karachi to Gilgit, from Quetta to Narawal, bringing accessible modern cancer care to communities from north to south and east to west of Pakistan. Every year, more than 1 million patients receive care through these facilities, including tens of thousands newly diagnosed. Their reputation extends beyond our borders, drawing patients from neighboring countries who trust in a system built on compassion, skill, and decades-long collaboration with the International Atomic Energy Agency, IAEA. And now, hope finds a home in Kashmir, the land known as heaven on earth, where mountains rise with quiet majesty and rivers carry the memory of centuries, has waited long for relief from the burden of traveling far for cancer care. That burden is now eased. The government of Pakistan delivers on its promise in Muzaffarabad, the Kashmir Institute of Nuclear Medicine, Oncology and Radiotherapy, KINOR, the 21st Atomic Energy Cancer Hospital in PAEC's life-saving network. Now, world-class diagnosis, treatment and compassionate care stand within reach of our Kashmiri brothers and sisters. KINOR is more than a hospital. It is a symbol of belonging, a bridge of care, a promise honored where it matters most. From the first center to the 21st, the story of Pakistan's atomic energy cancer hospitals is a story of steadfast commitment, not only to cure, but to care, not only to treat, but to heal. Because every region matters, every family matters, and every life matters.
Now I request the Honorable Chairman, Pakistan Atomic Energy Commission, Dr. Raja Ali Raza Anwar, Hilale Imtiaz, for his welcome address.
Bismillahirrahmanirrahim. Honorables, His Excellency Mia Muhammad Shehbaz Sharif Saab, Prime Minister, Islamic Republic of Pakistan, His Excellency Raja Faisal Mumtaz Rathore Saab, Prime Minister, Azad Jammu and Kashmir, Honorable Federal and AJK ministers, ladies and gentlemen, Assalamu alaikum. I feel extremely honored and privileged to welcome you all to inauguration ceremony of this state-of-the-art cancer hospital, KINOR, a facility built with an unwavering commitment to public service. Today, Pakistan Atomic Energy Commission stands as the largest cancer diagnosis and treatment services provider in Pakistan, with a network of 21 cutting-edge cancer hospitals, including 1 in Federal Capital, 6 in Punjab, 5 in Khyber Pakhtunkhwa, 5 in Sindh, and 1 each in Balochistan, Gilgit-Baltistan, and Azad Jammu and Kashmir. Excellencies, ladies and gentlemen, in PAEC hospitals, we treat more than 1 million cancer patients annually, thus managing about 80% of Pakistan's cancer burden. PAEC provides equitable quality care despite of the fact that nearly 60% of cancer patients who approach us are usually at advanced stages of cancer disease. Our nationwide awareness, screening, and outreach programs help reduce mortality and ease pressure on the national healthcare system. Each year, over 1,000 new and 10,000 follow-up cancer patients from AJK travel to Islamabad, Abbottabad, and other PAC hospitals for treatment. KINOR will spare these patients the hardship of long journeys by providing quality care close to their homes. KINOR is going to be a fully equipped cancer center with modern and advanced diagnostic and treatment technologies, supported by world-class, highly skilled PAC teams of oncologists, radiologists, nuclear medicine specialists, nurses, and dedicated staff committed to delivering compassionate and professional care. Excellencies, ladies and gentlemen, I sincerely acknowledge the generous and unwavering support of Government of Pakistan and Government of Azad Jammu and Kashmir that made this project possible. I also thank our leadership at SPD and all stakeholders for their trust and faith in PAC. Let us reaffirm that we can and will defeat the challenge and menace of cancer in Pakistan, inshallah. I thank you all, Excellencies, ladies and gentlemen. Pakistan, Paindabad.
Thank you for your kind words, sir.
Ladies and gentlemen, we are privileged to have a message from the Director General, International Atomic Energy Agency, which is an entity of United Nations, His Excellency, Mr. Rafael Mariano Grossi, sent for this auspicious occasion from Vienna, Austria.
Ladies and gentlemen, dear colleagues, far too many people die of cancer. In Pakistan, it is more than 100,000 people each year. Worldwide, the number has surpassed 10 million, and things are getting worse. Cancer deaths are expected to rise by 75% by 2050. Developing countries are getting hit the hardest. We must do and are doing more. It is why I launched the IEA's Rays of Hope initiative, procuring radiotherapy machines, conducting life-saving research, and providing training and education across the world. The government of the Islamic Republic of Pakistan is tackling the cancer challenge too. The Pakistan Atomic Energy Commission, PAEC, has established 20 cancer hospitals in the country and trained a fleet of professionals. I congratulate PAEC for establishing the latest Institute of Nuclear Medicine, Oncology and Radiology, KINOR. In my visit to Pakistan, Prime Minister Shehbaz Sharif and I discussed how to widen the IEA's and Pakistan cooperation in the peaceful uses of nuclear technology. During the visit, I saw for myself the diagnostic and treatment facilities at Nori and Inmol cancer hospitals. I also had the pleasure of inaugurating Pakistan's first public sector cyber knife facility. I would like to acknowledge the partnership of NORI as an IEA Rays of Hope anchor center. I am determined to widen the access to safe and secure radiotherapy and diagnostic imaging services. Technology only becomes a lifesaver in the hands of well-trained experts. Anchor centers serve as an important regional hub of capacity building and training all over the world. In closing, let me again congratulate Pakistan on this notable milestone and say that the IAEA looks forward to continuing its vital work with you in tackling the cancer crisis. Thank you.
Now I request the Prime Minister of Pakistan to share his words of wisdom with us.
Bismillahirrahmanirrahim. Honorable Prime Minister of Azad Jammu and Kashmir, Faisal Mumtaz Rathore, Dr. Raja Ali Raza Anwar, Chairman, PAEC, Dr. Chaudhry Ehsan Iqbal, Federal Minister Planning, Mr. Amir Muqam, Federal Minister, Rana Sanahullah, and honorable members of Azad Jammu and Kashmir Cancer Hospital, professors, surgeons, physicians, faculty members, ladies and gentlemen, Assalamu alaikum. It's really a great honor to be here to inaugurate this wonderful facility established for suffering humanity, and they are in thousands. I think there cannot be a better profession and a more important noble cause to serve those sons of the soil who have to travel far distances from Muzaffarabad and remote areas of Azad Kashmir to Islamabad and other places and get treatment for a disease which is life-threatening. I would like to comment the great efforts of Pakistan Atomic Energy Commission, and then of course SPD, philanthropists, doctors, and very caring parents for looking after this great facility to treat those people who don't have financial resources, yet they need most urgent medical treatment. Ladies and gentlemen, I myself, I am a cancer survivor. I could afford this very expensive treatment at that point in time. This is now more than 20 years ago. Imagine the plight of the common man in this country. Imagine those, coming from remotest areas of Pakistan. Imagine those who can't even meet their one meal a day. Imagine who work and toil untiringly with their sweat and blood, yet are not able to bring up and meet the expenses, educational expense of the children, let alone medical treatment. So here we are, a very valuable contribution of Pakistan Atomic Energy Commission, and of course combined with SPD. I think there cannot be a bigger service to suffering humanity than treating those patients who are at the edge of their life because of this threatening disease. Therefore, I'd like to comment your great efforts and like to encourage you to do more take fast steps and control and arrest this disease as best as possible through your innovative, outstanding efforts and teamwork. Ladies and gentlemen, thank you very much for your tremendous efforts. I've just visited MRI Plus machine and other mammograph machine, etc. I think the latest technology inducted in these latest versions. I think what is important is that they must be operated around the clock, so that the patients, if they come during middle of the night, they are given a smiling welcome and given a ray of hope and a genuine talk, so they are comforted. Their children, their kith and kin would pray for your long life, for your success for all times to come. Pakistan Pindabad.